I'm here with George Stamatelatos. George, you gave a wonderful talk. Interesting subject. I know Noel Alpins would have been here with us today. Noel, we're looking forward to seeing you at the next meeting. On a vector-based planning system for astigmatic laser vision correction that stop me if I have this wrong, George, that incorporates not only topographic data but manifest data too, the refraction data too?
That's right, Josh. So what we're talking about is a method of vector planning that Dr. Alpin's introduced, and this looks at not only treating on the basis of manifest refraction, but also bringing the corneal parameters into the treatment plan. And Josh, they can be corneal parameters with regards to the topography, or you can get a manual keratometry, or use total corneal power for the from an IOL master, for example, to look at planning the treatment for laser vision correction. In addition, if you want to treat on the basis of wavefront refraction, you can use the wavefront parameters as well as the corneal parameters. So it doesn't just have to be manifest refraction. It can be any refractive parameter that you can measure, but you're combining this in a systematic approach using vector planning with the corneal parameters.
So how are the data weighted if I'm combining both the objective topographic data and the semi-objective manifest data?
So what we're looking at, Josh, and we've done some studies in the past, and that started back in 2007 when we did a study of PRK on keratoconus patients. They were mild and formed froose patients. We also followed that up the following year in 2008 with wavefront parameters combined with corneal parameters using vector planning. However, most recently, Dr. Arbeles out of Oman has reported a study, and to be published in the ESCRS, I believe in October in this month, where she looked at 160 eyes, 80 eyes combined manifest refraction with topography data, and 80 eyes just manifest refraction alone, and she certainly found significant advantages with the vector planning treated eyes in that they obtained better visual results when you combined it in that system of vector planning.
That's really, really neat. And what is the data mix? Is it like 50-50 topographic manifest?
Yeah. So with previous studies that we've done, we found that sweet spot to be in the order of 60% towards refractive parameters. So putting the bias towards refractive versus corneal parameters. But you can indeed move that around depending on the ocular residual astigmatism. So the ocular residual astigmatism is an important parameter, which is the vectorial difference between the manifest refractive cylinder at the corneal plane and the corneal astigmatism. So when these two parameters are the same, then there's no need for vector planning.
Right.
But in most cases, this is different. And you need to know what number that is before you actually do surgery. And what do you do about it? Well, no matter what you do with it, Josh, you'll find that this difference, this vectorial difference between the manifest refractive cylinder and the corneal astigmatism is inherent. So no matter how good the surgery is, you're going to be left with this amount of astigmatism. And you need to deal with it. And the one way we deal with it, as I mentioned in the systematic way, is with vector planning. So the idea is to portion some to the refraction and some to the corneal astigmatism post-operatively. But what we do most importantly is with the refractive cylinder post-operatively, we aim for a zero spherical equivalent. So the patient doesn't actually notice this post-operatively. So you're gaining a reduction in corneal astigmatism, which is what the patient is left with at the end of laser surgery, and no increase in the refractive cylinder. And this is what Dr. Arbeles showed in her study. She got a reduction in corneal astigmatism, and the refractive cylinder was not affected in any way.
Oh, really, really, really neat stuff. Now, on a slightly different subject, Noel has a new book out.
That's
is that
right. That's right.
Yeah, can you tell me about that?
Yes, just being released at this meeting, in actual fact, Josh. And this is Practical Astigmatism Analysis is the book, and Dr. Alpin certainly started publishing on astigmatism back in 1993, and this is really where the book starts, right before 93, where Dr. Alpin was looking at dealing with astigmatism and how to analyse it and how to best treat it. In addition to the papers that he covers through this booklet, he covers all aspects of astigmatism, including vector planning, as we've mentioned, toric IOLs, mixed astigmatism, coupling factors, so pretty much everything that he's discussed through the years on astigmatism planning and analysis.
Great stuff, George. Really, really, really neat. I want to thank you for, once more bringing this technical but very, very practical subject to us, and as always for being so very generous with your time with us today.
Thank you, Josh. A pleasure.